Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. If you're working in general practice or training too, you've probably come across the term SMI, severe mental illness. This is a term concerned with some of our most vulnerable patients, and it's important we understand how to best manage them. So what is SMI? How do we manage it in primary care? And what is our role in the NHS framework? Let's break it down. So what is severe mental illness? This describes long-term conditions that do significantly impact a patient's ability to function in daily life. This might be difficult to conceptualize, as many of our patients with low mood or anxiety espouse a similar impact on their life. However, typically SMI patients have a psychiatric diagnosis made by a specialist and are often started on classes of medication that are beyond the scope of primary and secondary care. But these aren't just diagnoses, they represent significant chronic mental health conditions that can impact a patient's daily life, relationships, employments, and even their physical health. They include, but are not limited to, schizophrenia, bipolar affective disorder, severe depression with psychosis, eating disorders, and obsessive compulsive disorder. So why are we concerned with this class of patients? The reality is that severe mental illness, SMI, has a profound impact on a patient's functionality, from relationships and family dynamics to activity levels and the ability to work. Every aspect of their life is affected, even in many cases after remission. These patients often exhibit challenging behaviors, medication non-compliance, and poor lifestyle habits that do make them particularly prone to secondary complications. This goes some way to explain why patients with SMI on average have a reduced life expectancy of between 15 and 20 years compared to those compatriots without SMI. As part of our reviews, our job isn't to replace psychiatry, it's to hold the patient's whole picture, including their mental and physical health. SMI is part of the Quality and Outcomes Framework, or QOF. This means there are specific NHS targets we aim for: annual physical reviews, smoking cessation, and medication reviews. Meeting these not only improves the care but also supports your practice. Components of SMI care in primary care. Diagnosis and risk. Start by confirming the diagnosis, ideally from secondary care. Assess their risk level, including suicide risk, self-neglect, or harm to others. Consider the patient if they have capacity for making medical decisions, especially when they're unwell. Medication monitoring. Many patients will be on antipsychotics, mood stabilizers, or a combination of psychotropic medications. As primary care clinicians, we're responsible for monitoring side effects, adherence, and doing regular blood tests like lithium levels, liver function, and metabolic marker monitoring. Keep an eye out for polypharmacy and interaction, especially in your older patient cohort. Annual physical health checks. One of the most important roles we have is our responsibility to deliver the annual SMI physical health review. That includes checking the blood pressure, the BMI, glucose, lipids, smoking status, alcohol use, and of course, a full medication review. People with severe mental illness have a much higher risk of cardiovascular disease and metabolic syndrome, so this work is vital. Social and functional support. Don't forget the wider picture. Many patients with severe mental illness may struggle with housing, employment, and social isolation. Ask about their day-to-day life and refer to social prescribing, housing support, or even benefits advice where needed. This is where your care can go far beyond the prescription pad. Crisis and risk planning. It's important to know what to do when there's a crisis, so make sure there's a plan in place. Who do they contact in emergency? Are they under a community treatment order? If something goes wrong, we need to act quickly and ensure we have a clear plan in place that will make things easier. Working with secondary care. Don't forget you're not alone in this. Good communication with community mental health teams, psychiatrists, care coordinators, and crisis service makes all the difference. Do not hesitate to reach out. Joint care is safer and much more effective. Final thoughts for today. Caring for patients with severe mental illness in general practice can be complex, but also incredibly rewarding. We're in a unique position to support patients, not just with their mental health, but also throughout their entire lives. It's about listening, coordinating, building trust over time, and this is part of why severe mental illness is so important in general practice. If you found this helpful, please give it a like, subscribe to the channel, and we promise to carry on delivering clinically focused content. We'll see you in the next video.